Welcome to our comprehensive guide on neurological assessment, specially designed for nursing students. In this video, we'll walk you through the essential steps and concepts needed to confidently perform and interpret neurological assessments. Understanding the nervous system is crucial for identifying patient needs and providing effective care. We'll begin by outlining the learning objectives, then move step by step through anatomy, physiology, examination techniques, and interpretation of findings. Whether you're preparing for exams or clinical practice, this video will help you build a strong foundation. Let's get started and explore how you can make a real difference in patient outcomes through skilled neurological assessment. Before we dive into the details, let's clarify our learning objectives. By the end of this session, you'll be able to identify the main anatomical structures of the nervous system, describe their physiological functions, recognize the 5 key components of a complete neurological examination, perform a thorough physical assessment, and interpret your findings accurately. These objectives are designed to ensure you not only understand the theory, but can also apply your knowledge in real clinical settings. Keep these goals in mind as we progress, as they will guide your learning and help you focus on what's most important. Let's start with an overview of the nervous system. The nervous system is an intricate organ system that coordinates both voluntary and involuntary actions by transmitting signals throughout the body. It's responsible for everything from simple reflexes to complex thoughts and emotions. In this section, we'll look at its main functions: sensory input, integration, and motor output. Sensory input gathers information from inside and outside the body. Integration processes and interprets this information, and motor output initiates responses in muscles or glands. Understanding these basics sets the stage for effective assessment. The nervous system has 3 primary functions: sensory input, integration, and motor output. Sensory input comes from receptors that monitor changes inside and outside the body. Integration is the process where the nervous system interprets sensory input and decides what should be done. Finally, motor output sends signals to muscles or glands to produce a response. These functions work together seamlessly to maintain homeostasis and respond to the environment. As you assess patients, keep these functions in mind. They help you understand symptoms and guide your examination. A thorough neurological assessment begins with asking about symptoms and patient history. Common neurological symptoms include pain, Zeitzeris, dizziness, vertigo, headaches, abnormal sensations, numbness, weakness, unsteadiness, nausea, vomiting, visual disturbances, and altered consciousness. Understanding these symptoms helps you focus your examination and identify potential neurological diseases. Always approach the patient with empathy and ask open-ended questions to gather as much relevant information as possible. This initial step is crucial for accurate diagnosis and effective care planning. Neurological assessments are especially important for patients suffering from conditions like meningitis, head injury, brain tumors, unconsciousness, high-grade fever, tetanus, or coma. Recognizing when to perform a neurological assessment ensures timely intervention and can be life-saving. Always be alert to changes in a patient's condition, and don't hesitate to perform a focused neurological exam if you suspect any central or peripheral nervous system involvement. Early detection and intervention are key to improving patient outcomes. A complete neurological examination consists of 5 main components: mental status exam, motor system assessment, sensory system assessment, cranial nerves assessment, and reflex testing. Each component provides valuable information about different aspects of the nervous system. By systematically working through these areas, you can identify abnormalities and localize neurological deficits. In the following scenes, we'll break down each component, explain how to perform the assessments, and discuss what findings to look for. The mental status exam evaluates a patient's emotional and cognitive functioning. It includes 4 key areas: appearance, behavior, cognition, and thought processes, often remembered as A, B, C, T. Assess posture, body movements, dress, grooming, and hygiene. Observe facial expressions, speech, and articulation. Evaluate mood and affect by asking direct questions and noting responses. Assess orientation, attention, memory, and higher intellectual functions. This comprehensive approach helps you detect changes in mental status that may indicate neurological or psychiatric conditions. Level of consciousness, LOC, is a critical indicator of brain function. It can be assessed using the Glasgow Coma Scale or by observing alertness, lethargy, stupor, and coma. Pay attention to facial expressions and the patient's ability to respond appropriately. Speech should be fluent and clear. Any changes in LOC require immediate attention as they may signal serious neurological compromise. Accurate assessment and documentation of LOC are essential for monitoring patient progress and guiding interventions. Assessing the cranial nerves provides insight into the integrity of the central nervous system. Test each nerve systematically: smell for olfactory, vision for optic, eye movements for oculomotor, trochlear, and abducens, facial movements for facial nerve, hearing for acoustic, taste and gag reflex for glossopharyngeal and vagus, shoulder shrug for spinal accessory, and tongue movements for hypoglossal. Note any asymmetry, weakness, or abnormal responses. This detailed examination helps localize lesions and guide further investigations. The motor system assessment evaluates muscle strength, tone, bulk, and coordination. Observe the patient's gait, balance, and ability to perform rapid alternating movements. Tests like the Romberg sign, finger to nose, and heel to shin help assess cerebellar function. Grade muscle strength on a scale from 0 to 5, noting any weakness or involuntary movements. These findings can indicate disorders affecting the motor pathways, such as stroke or neuropathy. Always compare both sides for symmetry. The sensory system assessment checks the patient's ability to perceive touch, pain, temperature, vibration, and proprioception. Use tools like cotton, pins, and tuning forks to test different sensations. Reflex testing includes superficial, deep tendon, and pathological reflexes like Babinski. Grade deep tendon reflexes on a scale from 0 to 4. Abnormal findings may indicate peripheral neuropathy, spinal cord injury, or central nervous system disease. Accurate sensory and reflex assessment is vital for a complete neurological evaluation,